Back in May, the last week in May, my brother and I went to Kansas City, my wife along with us, and one of my cousins, Pastor Michael Warren, told me after the service that he wanted to talk to me about something. And he started sharing with me about the life wave patches. And of course, I've got several health issues, so I told him I was interested in knowing. He sent me the testimonials, and I listened to them, and got a chance to talk to Eric, and I told him that I wanted to sign up and try them, and so I did get the patches. And I'm a diabetic. I have sarcoidosis, which is a lung disease, and for the last few years I've been breathing at about 72% on a good day, and every day wasn't good. I have high blood pressure, and as a result of being a diabetic for several years, I had neuropathy in my feet, and also deal with sleep apnea. Within 3 weeks of taking the patches, the neuropathy in my feet cleared up. My diabetes, I went to my endocrinologist, and my diabetes went from 8.7 to 6.5. And I just saw the doctor again this week, and my number is now 6.0.
How long have you been on the patches?
I've been on the patches now since the last week in May up until now, but I'm saying that I got good results in just 3 weeks.
It's amazing how your numbers went from 8.7 to 6. That's a big deal.
It is. My sarcoidosis, I have a lung disease called sarcoid, and anytime the doctor would take a picture of my lungs, X-ray of my lungs, the specks on my lungs looked like a cancer patient. And I've had a couple of surgeries, and when the doctors, were pre-tested me, they did an X-ray, and they had to call my pulmonologist to get me clearance for this surgery because they always thought I had cancer, but it's the specks of my lungs look like a cancer patient. I developed sarcoid at the age of 23 years old, and they treated me aggressively, and it went in remission until I was age 47. It came back with a vengeance. And the doctor told me that I would probably have to deal with it the rest of my life. I've been taking prednisone. I've been doing albuterol updrafts. I've been doing the Advair powder puff. I've been doing the rescue inhalers. But in the last 3 months, my lungs have cleared up, and all the things that I mentioned to you that I've been doing, I'm not doing any of it now.
What can I ask you? What patches you're wearing, Pastor?
I'm wearing the X39. I'm wearing the Aeon and the Carnosine. I just started the last week wearing the X49.
That's so great. The X39 is your stem cell activation. Aeon's going to reduce that inflammation in the lung, and Carnosine and X49 are wonderful support for the heart, brain, and lungs. So Carnosine, great organ support. Oh, and also Carnosine organ support for the pancreas. I mean, Eric got you on a good customized pack, I would say.
Yes, ma'am. Yes, ma'am. It has worked wonders for me because I've been taking this prednisone every day since I was 47 years old. And with that comes water retention. Then you got to take fluid pills to get the fluid off of you. So my body's just been going back and forth. And the doctor told me several years ago, he said, you will not live a full life. He said, you got too much going on. You're diabetic, you got high blood pressure, you have sarcoid. You take these medications, and there's a battle going on in your body, and somebody gonna win, and it won't be you. And I told him that day that I was gonna live till I died. But I went to my kidney doctor just a few weeks ago, and he told me that my kidney function had greatly improved since January. I just started the patches in May. And then he checked my blood pressure. He said, wow. I said, what's wrong? He said, man, you never had a perfect blood pressure. He said, your blood pressure is 120/80. He said, Mr. Withers, you're probably going to live to be 100 years old. Of course, I told him I wasn't trying to accomplish that, but I was wanted to just have a good quality of life. So
That's
that is,
what a story. I'm sorry, go ahead.
I said, that has really blessed me. The
So-
last thing that occurred, I'm on a CPAP, and I did my annual visit to the sleep clinic. And after they did what they needed to do, she said, Mr. Withers, when we put you on a CPAP, your number was at 17, and so we had to give you a CPAP to use. They said the goal was to get that number down to 5. I said, well, what is the number of the day? She says 1.1. She said, I can't believe it. She said, whatever you're doing, you're on track. They had to lower the volume of air that I'm getting in my CPAP because she said, you don't need all that air now. And so, Mr. Withers, whatever you're doing, you're on track.
Wow.
Now, I've had those things to happen to me, and it has completely changed my life. I flew last week to Atlanta, my brother and I, and went up on a plane, came back the next day. I didn't take any of the medications that I usually take, and then had to take my updraft machine with me and all that stuff. And I haven't lived like that. Everywhere I went, I had to take my medicine bag, my updraft machine, and all that kind of stuff. So it has completely changed my life.
Do you feel more free?
Yes, ma'am. Totally free. Totally free.
Well, and so have you been sharing this with your congregation? Like, tell me, what have you been sharing your story?
I shared it with congregations, and I guess since I've started this, I'm sure about 25 people have signed up, and you know, people are asking me what's going on. I was in a setting a few weeks ago, and I shared my testimony, and I've been getting just all kind of calls from that. You know, people are just excited about it, and everybody wants to change their life. And I know that everybody, if they are with 50, 60, 70 years old, we got something going on. And so I'm just excited about it. And of course, when you experience what I call a miracle, you can't help but to tell somebody about it.
You had a miracle.
Eric has been a blessing to me. You know, he's walked me through this, and he's helped me to sign people up. And I finally got to the point that I think I can do it now, but it's just been a blessing. I don't have a plan to stop using the patches.